My name is Dr. Sean Irwin. I am an associate professor in the School of Business at Royal Roads University. Broadly speaking, I have a particular interest in social and economic international development, with particular focus currently in Latin America and Africa, and a particular more niche focus on food systems and global health. The latest project is particularly focused on continuing to develop the aquaculture sector in Bolivia, but with a focus on women's empowerment in particular. What's quite interesting down there is that the aquaculture that's happening is very environmentally benign. So aquaculture, or the fish, for example, are grown in earthen ponds that are lined with clay. Water is acquired through they're rain-fed ponds. They're filled with rain. So it doesn't put any pressure on natural water sources. Very little use, or really no use, of chemicals or antibiotics or anything like that. A very sort of low input production system. And then socially, one of the really interesting things is that it's become a real sort of potential livelihood for women in particular. So what has happened over time now is that women are starting to get more and more ambitious about it. The fish is actually fairly is fairly profitable relative to other livelihood opportunities, and this is leading some women to create organizations, to start other businesses, restaurants and markets and so on. And there's a real sort of snowball effect of economic growth.
You also work with Malawi. Can you tell us about your innovative project, Streams?
So what Streams is basically a response to the really awful, problematic situation of poor WASH, so water, sanitation, hygiene, in healthcare facilities. We have a pretty good understanding of the problems, but how do you fix that? How do you make some positive change towards improving these things? And so they started to develop Streams, and what Streams stands for is systems, training, empowerment, and monitoring support. And then we partnered up to apply for this grant to really test it, and in the process really refined the program, started to figure out how it was going to be implemented, and then started to look at exactly how it was affecting both patients and staff. So we did our testing, and we found that there was still some things to work on. It's not an easy process, very dynamic program, but really positive results, really excellent community buy-in, really meaningful feedback from both patients and staff, because that's also really critical, is you have to keep staff healthy and safe as well. What I want students to take away is that they can do something that has impact in the world, that what they are doing matters, and that they should have a little bit of fun at it at the same time too, that the world is in need of their skills, and they should lean into that. The other thing I'd like to say is that I'm very appreciative of your focus on this idea of impact, of making a difference, of focusing in on those folks that are trying to make the world just a little bit of a better place. And it's sometimes a little cheesy to say sometimes, but I think we kind of need to lean into that language a little bit more often. And so I really commend CUFA BC and yourself for doing that, and all the other people that were nominated as well. I read through some of the all the biographies, and I'm quite humbled actually to receive the award, because folks are just making some really interesting and really profound contributions to not just knowledge, but to how the world can become a little bit better.